Can you tell us a bit more about talking to GP practices about Pharmacy First? How did that go?
This is probably the first time in my career where the GP practices were asking to talk to me. Normally, I'm the one with my hand up saying, please, can I come and talk to you about something? And this is the first time they've actually said, Reena, can you come and talk to us about Pharmacy First? So that's been really positive, really, really encouraging. When I get an email from my local GP practice saying, Reena, can you come to our meeting and talk to us? I'm like, yes, of course I will, love to. It's been really encouraging, and I can see that general practice really want Pharmacy First to work, because obviously it's in their interest if we can free up those millions of appointments that it's supposed to do, and then they can obviously concentrate on seeing the patients who really do need to see a GP, and the ones that can just see a pharmacist will be able to see a pharmacist. So that's been really, really encouraging. And obviously with any new service, there are teething problems as you're implementing things, and we're learning new IT systems, and people are learning new ways of working and new pathways and models of care. But the fact that we've got good open dialogue and good relationships with our general practice colleagues is really helping to implement this service.
Now, you've tweeted about using AccuRx. What is that, and what can it do for you?
When we're implementing this new service, we wanted to look for solutions that can make things a little bit easier for us. And one of the IT softwares that we've been using for a long time is called AccuRx. And what we were using it for was a messaging system to our patients to tell them the prescription's ready, or to invite them for a blood pressure check, or remind them of a COVID vaccine appointment. And what we realized is that actually there's more to AccuRx than we first thought. So using AccuRx for the launch of Pharmacy First has helped us to do several things. One is to create templates for the safety netting information that we have to make sure we give to a patient when they've seen us for any of those clinical pathways. So we created 7 templates for the 7 conditions, with all the information and the leaflets attached that we need to make sure we send to patients or give to patients. So that allows us to make sure that we either if they're in with us in the consultation room, we can give it face to face. But actually, to get a text a few hours later, sometimes when they've got more time in their own home to read the medical information that we may want to share with them, that's actually really beneficial. AccuRx also allows us to see the health record for some patients. So, for example, if they don't have a summary care record, we're able to use AccuRx with the patient's permission to look at their health record. And that's really important when we're taking important decisions to supply prescription-only medicines via patient group directions. If you look at some of the exclusion criteria for these PGDs, you'll see there are a lot of medical questions, and sometimes patients don't know the answer to those questions, so it's helpful to have access to the records. And then the third thing that we're really hoping to trial out is video consultations that we're able to do using AccuRx. And we feel this will be a game changer. One, because many pharmacies like mine only have one consultation room. And actually, while we're busy doing flu, COVID, hypertension, contraception, and other local services, plus Pharmacy First, that one room is really being utilised quite a bit. And if we're able to create a little corner of our pharmacy that's in the closed off area where we could set up video consultations, that allows us to maybe have an extra space to be able to offer the same level of consultations, but virtually, which sometimes some patients may prefer. So we haven't tried it yet, but we're really excited about using that new part of AccuRx. And that's why we really wanted to kind of explore the possibilities, because we realise we can't keep doing the things we've always done with the change that's come in. We need to think differently and kind of bring about some digital tools to support us.
And how did it go? Can you tell us how many patients you've seen and what worked well?
I'm happy to share our first figures from our first month. So we saw 40 patients in the first month who were referred to us. And of those patients, 10 met the clinical pathway gateway. And of those 10, 7 we were able to prescribe, or not prescribe, supply something using a PGD. So what was interesting for the 3 that met the gateway but we didn't give an antibiotic to was actually we were able to support them with self-care, which is a really important message. And what their patients felt grateful about was that we were able to say, look, your symptoms aren't that severe right now. Sometimes these cases can be viral. And we gave them some advice on how to support them with their symptoms. But actually, if they needed to come back because their symptoms worsened, the route to get back into pharmacy is really, really simple. You just turn up or you ring. It's not like you have to ring the next day at 8:30 in the morning, try to get an appointment, and they say, sorry, we have to wait 3 days. And so actually, what Pharmacy First is going to create, I think, is an absolutely great way of supporting the self-care agenda. because a lot of the time people can just look after themselves and don't need antibiotics. And the second thing is I'd like to see a reduction in prescribing of antibiotics because of the Pharmacy First scheme, because of the ease at which patients can come back if their symptoms deteriorate. Whereas before, patients would sometimes worry, maybe put pressure on a prescriber, or maybe, even a prescriber may be thinking, gosh, what if this gets worse? This is a young child in front of me and I'm not going to be able to see them tomorrow. And that probably maybe would play into decisions about antibiotic prescribing potentially.